What if one of the most powerful ways to support your blood pressure after 60 had nothing to do with pills, strict diets, or exhausting workouts? For many years, older adults were told that exercise had to be intense to be effective, that unless you pushed your body hard, nothing would really change. But modern research tells a very different story. Leading health organizations now agree that gentle, consistent movement can play a major role in supporting healthy blood pressure, improving circulation, and protecting the heart, especially as we age. In fact, studies reviewed by the American Heart Association, Harvard Medical School, and the Centers for Disease Control and Prevention show that low-impact exercise, when done regularly, can help reduce strain on the heart while also improving balance, mobility, and overall quality of life. This is especially important because high blood pressure affects nearly 2 out of 3 adults over the age of 60. Left unmanaged, it increases the risk of heart disease, stroke, fatigue, and loss of independence. But here's the good news. Movement does not have to be fast, painful, or exhausting to be effective. Today, we're going to walk through 6 gentle, research-supported exercises that are safe, approachable, and effective for older adults. These exercises are designed to support healthy blood pressure naturally, without putting unnecessary stress on your joints or heart. Before we begin, let us know in the comments your age and where you're watching from. We read and respond to as many comments as possible. Now, let's get started. Exercise number 6, gentle walking for blood pressure support. We'll begin with one of the simplest, safest, and most powerful forms of movement for supporting healthy blood pressure after the age of 60. Gentle walking. Walking is widely recommended by doctors and major health organizations because it strengthens the heart without putting stress on the joints. According to the American Heart Association, regular, moderate walking helps the heart pump blood more efficiently, which can gradually reduce pressure inside the arteries. As we get older, blood vessels naturally become less flexible. This stiffness makes it harder for blood to flow smoothly, often causing blood pressure to rise. Gentle walking helps counter this process by improving circulation in a steady, sustainable way. One of the greatest benefits of walking is accessibility. You don't need special equipment, a gym membership, or athletic experience. Walking can be done almost anywhere, on a flat sidewalk in a quiet park, inside a shopping mall, or on a treadmill with handrails. To get started safely, wear comfortable, supportive shoes and choose a stable surface. Begin at a slow pace for the first 2 to 3 minutes to allow your heart rate to rise gradually and your muscles to warm up. After warming up, increase your pace slightly to a comfortable, moderate level. A helpful guide is the talking test. You should be able to speak in full sentences while walking, but singing would feel difficult. There is no need to walk fast. The goal is consistency, not speed. Start with about 10 minutes per session, 3 to 5 days per week. Over time, many older adults naturally work up to 20 or 30 minutes, but even shorter walks provide real benefits. At the end of your walk, slow down for another 2 minutes to help your breathing and heart rate return to normal. Walking also reduces stress, which plays a major role in blood pressure control. Gentle, regular movement can make a meaningful difference over time. If this sounds manageable for you, comment the number 1 below to show you're ready to start. Exercise number 5, Tai Chi for calm movement and healthy circulation. Next, we move on to Tai Chi, a gentle and flowing form of movement that has been widely studied and recommended for older adults. Tai Chi is especially helpful for people over 60 because it combines slow physical movement, controlled breathing, and mental focus. This combination supports both the body and the nervous system, which is important because stress and tension can directly affect blood pressure. According to research reviewed by Harvard Medical School, Tai Chi helps activate the body's natural relaxation response. When the nervous system is calm, blood vessels can relax more easily, allowing blood to flow with less resistance. Over time, this can support healthier blood pressure levels. One of the greatest advantages of Tai Chi is how gentle it is on the joints. There's no jumping, no sudden movements, and no strain on the knees, hips, or back. This makes it an excellent option for older adults who may experience joint pain, stiffness, or balance concerns. Tai Chi can be practiced while standing or seated, depending on your comfort level. If standing feels difficult, sitting upright in a sturdy chair works just as well. To begin, find a quiet space where you feel comfortable and relaxed. Stand with your feet about shoulder width apart, or sit tall in your chair with both feet flat on the floor. Let your shoulders drop naturally and soften your posture. Start with slow, steady breathing. Breathe in gently through your nose, then breathe out slowly through your mouth. Try not to force the breath. Simply allow it to flow smoothly. After 1 or 2 minutes of breathing, add a simple movement. Slowly lift your arms in front of your body to about chest height as you breathe in. Keep your hands relaxed and your elbows slightly bent. As you breathe out, gently lower your arms back down. Move slowly and comfortably. The goal is not precision or strength, but calm, continuous motion. If standing, you may gently shift your weight from one foot to the other. If seated, simply focus on the arm movements and breathing. Begin with 5 to 10 minutes per session. Over time, many older adults find they can gradually increase to 15 or 20 minutes. Tai Chi can be practiced 3 to 5 days per week, or even daily, because it is low stress and easy to recover from. By encouraging relaxation, balance, and gentle circulation, Tai Chi supports both emotional well-being and healthy blood pressure in a safe and approachable way. Exercise number 4, gentle cycling for heart health exercise. Number 4 is gentle cycling, which can be done on a stationary bike or outdoors on a safe, flat surface. Cycling is one of the most joint-friendly ways for older adults to support heart health and blood pressure. It places very little stress on the knees, hips, and back, while still providing cardiovascular benefits. According to the American Heart Association, aerobic activities like cycling help strengthen the heart muscle. A stronger heart pumps blood more efficiently, reducing pressure inside the arteries over time. One of the biggest advantages of cycling is control. You can easily adjust the speed, resistance, and duration to match how you feel on any given day. To begin safely, adjust the bike seat so that when one foot is at the bottom of the pedal stroke, your knee is slightly bent. This helps protect your joints. Sit upright with a relaxed posture and rest your hands lightly on the handlebars. Begin pedaling slowly for 2 to 3 minutes as a warm-up. Focus on smooth, steady movement rather than speed. After warming up, gently increase your pace to a comfortable level. You should be able to talk in full sentences while cycling. Start with about 10 minutes per session, 2 to 3 days per week. As your comfort improves, you can gradually increase the duration. When finishing, slow the pace again for a few minutes to allow your heart rate to return to normal. Gentle cycling supports circulation, heart health, and stress reduction, all important factors for healthy blood pressure. Exercise number 3, swimming and water. Aerobics for gentle heart support. Next, we move on to swimming and water-based exercise, which can be an excellent option for older adults, especially those with joint pain, stiffness, or limited mobility. Water naturally supports much of your body weight. This reduces pressure on the knees, hips, and back, while still allowing your muscles and heart to work gently. Because of this, swimming and water aerobics are often recommended for people who want to stay active without discomfort. According to the American Heart Association, moderate aerobic activities performed regularly can help support healthy blood pressure by improving how efficiently the heart and blood vessels work. Swimming and water exercise fit well into this category. You do not need to swim fast or for long periods to benefit. Many community pools and senior centers offer shallow water classes designed specifically for older adults. If swimming laps feels challenging, simple movements such as walking in the pool or gentle water aerobics can be just as effective. To begin safely, choose a pool that feels comfortable and not too cold. Enter the water slowly using handrails if available. Start with a light warm-up, such as walking in shallow water for 2 to 3 minutes. After warming up, add easy movements, like gentle arm swings or lifting your knees slowly. Begin with about 10 minutes per session and gradually increase as your comfort improves. Water exercise can be done 2 to 3 times per week or more often if it feels good for your body. If water exercise feels like something you could try, comment the number 1 below and let us know. Exercise number 2, gentle yoga and breathing. Exercise number 2 is gentle yoga combined with slow, controlled breathing. Gentle yoga focuses on smooth movement, flexibility, balance, and relaxation rather than strength or speed. This makes it especially suitable for people over 60. The National Institutes of Health explains that yoga may help support blood pressure by reducing stress and activating the body's relaxation response. To begin, choose a quiet space and wear comfortable clothing. Movements can be done standing, seated in a chair, or using a wall for support. Start with posture and breathing. Sit or stand upright. Relax your shoulders and gently lengthen your spine. Breathe in through your nose for a count of 4, then breathe out through your mouth for a count of 6. Continue this breathing pattern for 1 to 2 minutes. Next, add simple movements such as gently raising your arms while breathing in and lowering them as you breathe out. Move slowly and comfortably. There should be no pain or strain. Begin with about 10 minutes and gradually increase as comfort improves. Gentle yoga supports relaxation, mobility, and healthy blood pressure in a calm and approachable way. Exercise number 1, light resistance training for strength and blood pressure support. Finally, we come to light resistance training. This type of exercise is often misunderstood, but when done gently and correctly, it can be very beneficial for older adults. As we age, muscle mass naturally decreases. This loss of strength can affect balance, mobility, and even circulation. Light resistance training helps maintain muscle strength, which supports daily independence and overall cardiovascular health. According to the American Heart Association, moderate resistance training can improve how blood vessels function and may help support healthy blood pressure over time. Stronger muscles assist the heart by improving circulation and reducing strain during everyday activities. Light resistance training does not mean heavy weights or intense workouts. Simple tools such as resistance bands, light dumbbells, or even your own body weight are more than enough. Chair-based exercises are especially helpful for beginners or anyone with balance concerns. To start safely, choose 1 or 2 simple movements, such as seated leg extensions, gentle arm curls, or wall push-ups. Move slowly and focus on controlled motion. Always remember to breathe steadily and avoid holding your breath, as this can temporarily raise blood pressure. Begin with short sessions of about 10 minutes, 2 days per week. As your strength and confidence improve, you can gradually add time or an extra session. When done consistently, light resistance training supports strength, circulation, and long-term heart health in a safe and manageable way. If you feel ready to try gentle strength exercises, comment the number 1 below and let us know. Closing. These 6 gentle exercises are backed by trusted health organizations and designed to help older adults stay active while supporting healthy blood pressure. Remember, small and consistent steps can make a real difference over time. If you found this video helpful, like the video, subscribe to the channel, and click the bell so you don't miss future videos. And before you go, leave a comment and tell us which exercise you're going to try first.